Hello everyone, my name is Damien. I have been a nurse for a little over a year. I graduated Polk State back in December of 22, and this is my leadership presentation. The main topic I want to focus on is empowerment, and there are 3 topics or articles that I want to kind of reference and kind of go over that really talk about empowerment. The first one is going to be how in the workplace we can create empowering environments for our nurses to create a better staff environment, satisfaction, and reduce nursing burnout. The second topic I want to talk about is going to be nurses empowerment from a middle management perspective, to include nurse managers, management, and A&Ms. And then the third one I really want to talk about is going to be kind of what I believe is tied in with empowerment, is having autonomy within the workplace that allows for a more empowering environment for us as nurses and management. So my personal belief on empowerment is to empower yourself and your employees to be able to make decisions on their own and have the justification to do so. All right, so let's jump straight into the first article about creating empowering conditions within the workplace. And this article really focuses on which leadership style works best for empowerment, especially within the healthcare system. And one style that works really well is going to be the transformational leadership style, which really allows the leader to inspire, motivate, and collaborate in decision-making throughout their department. This also creates environments where nurses feel more valued, more motivated to complete their work, engage in their roles, and ultimately really leading to improved patient outcomes, decreased nursing burnout, and improved nursing job satisfaction. Another really key component within this article is ensuring that you have like a supporting work environment through your leadership staff that really promotes a culture of trust, respect, and collaboration, because really trust, respect, and collaboration are really key components to allow your staff to thrive and have the knowledge and ability to feel empowered within their respective roles. And also another key component is going to be an environment of professional development that really allows the staff to continually grow within their roles, that will help them feel more empowered and have the ability to expand upon their knowledge and skills via either training or education, anything along those lines. And then lastly, this article really focuses on ensuring that leadership serves as really the first and foremost as role models for their staff by demonstrating their personal integrity, professionalism, and resilience within their unit, and also demonstrating their ability to feel empowered themselves, all of which really inspire nurses to strive for more empowerment throughout their respective roles. All right, and the second article I really want to talk about is nurses empowerment through a middle management perspective. And what that really means is going to be talking about primarily about your nurse managers, assistant nurse managers, and really talks about 2 important steps of empowerment, to include psychological empowerment and organizational empowerment. What they mean by psychological empowerment throughout this article is the importance of your staff, really being in a motivational state that is based off of a theory that those who believe that they will succeed have a better opportunity, chance of doing so than those who do not hold that belief. And organizational empowerment is comprised of really 4 major elements that include really having the access and resources to information, job expectations that will allow for the empowerment, ability to attain those resources to actually do the empowerment, and also the ability to advance in your current role through either training or qualifications, each of which are important components of employee empowerment. So really, psychological and organizational empowerment are both really like key components in allowing for employee empowerment. And lastly, this article really demonstrates what can happen if you fail to empower middle management and staff. That will actually lead to decreased retention at both the management levels and the staff levels, directly impairing the delivery of safe patient care. So really, it's important to make sure that you also empower your nurse managers, leaders, staff, everyone throughout the hospital has the ability to be empowered within their roles. All right, so let's jump into the third article. And the third article I really wanted to speak about because I believe it really ties really well into empowerment, and that is going to be autonomy within the workplace. As we may already know, autonomy is really just the nurse's ability to act upon our professional knowledge that we have, exercise judgment over our patient, and clinical decision making. Also been shown nurses who work in an environment that foster empowerment and autonomy in comparison to those that do not have actually decreased burnout, improved patient outcomes, greater levels of teamwork, and ultimately greater quality of care for our patients. And again, I think empowerment and autonomy are similar, as they both really allow us as nurses the authority and control to make decisions over ourselves and the patients that we are taking care of. And I also believe each of which are essential for really a positive environment that fosters empowerment and teamwork and enables nurses to grow professionally and personally. Lastly, autonomy and empowerment both lead to creating a healthy and professional work environments, and that will lead to, again, increased patient outcomes and improved patient odds. All in all, I think empowerment really plays an important role within the field of nursing and healthcare in general. All right, and those are the three main topics I wanted to talk during this leadership conference, and how empowerment can be used within leadership in nursing. I think empowerment is a tool that nursing leaders and staff should be utilizing regularly, and ensuring that each staff member has the ability, resources, and information to really feel empowered within their roles. All right, so that concludes my leadership conference presentation. I hope you enjoyed it, and I really hope you all learned something from this.